Hi everybody, I'm Nigel Twelves. I'm a GP in Northumberland and I'm also the Medical Director for Northumbria Primary Care.
And I'm Catherine Murray, another GP for MPC.
We're here today to introduce to you our new Northumbria Primary Care clinical strategy and to have a brief chat about some of the details which you might find interesting.
So we've been working on the clinical strategy for about the last 12 months, haven't we, Nigel?
Yep, and I think we've listened to a lot of people and come to an agreement about the best way for us to improve patient outcomes and also to ensure that patient care is the best that we can provide.
Absolutely, it is really important, and it's going to be key to helping ensure that we're focusing on the right areas over the next few years as we take the strategy forward.
I think so, and what we've got to remember is that we need to try and tailor the services that we're providing to individuals, but we work with a lot of varying groups of people and we work with a very diverse geography as well.
Yeah.
So it's going to be a challenge to us to be able to provide that across the whole of Northumberland and North Tyneside.
Yeah, and there are a few areas we've chatted about that we'd like to try and make some improvements in to kind of really maximise the best care that we can provide for our patients. The obvious one that's been in the news a lot recently is about access and getting that right and getting that access available for everyone who needs it.
The strategy was built around a number of discussions that we had with patients and that we had with our colleagues, and we prioritised 6 areas.
Yeah.
And the 6 areas do include access, as you quite rightly said, but they also include integration of care with our other providers to make sure that when people need services within the healthcare system, that they can move smoothly through them. At the moment, there are far too many artificial barriers that we seem to have to negotiate, both as professionals and as patients.
Absolutely.
And that's just not helpful.
Yeah. And there's a lot of duplication as well. So you talked about us being intelligent. So there are some bits that it feels like we're all doing in our own little ways, and if we could help to tie that together a bit better and ensure that we're using the staff, you know, the workforce that we have and the facilities that we have to do things once and do them well, that would be a really great endpoint to this.
Absolutely.
Wouldn't it? Yeah.
So within the system, we're going to have a lot of people who've got long-term conditions which need managing, which is another of our 6 priority areas.
Okay.
But we're also going to need to look at prevention of disease moving forward. We can't continue to just provide more and more resource to try and look after people's illness. We need to try and help people prevent them become ill in the first place. And we need to make sure that those people who do need our services find it a fair and accessible, easy service to get through, making sure that just regardless of what your needs are, you feel as important as the next person when you come to the surgery and you get treated fairly and in a human way.
And that's why I guess the conversations that we've been having with patients are key to this as well, because we need to hear from them how we ensure that we keep it fair and equitable, because sometimes when you're in it, it's a little bit harder to see that, and seeing it from the other side and knowing what barriers or difficulties have existed is really going to help us with that particular element of the strategy to make sure that we get it right.
Sure. I think the equitable care is really important, particularly as we know that there are reasonable adjustments that a lot of people need to make sure that they can get through the service as smoothly as possible.
Absolutely.
And ensure that they do get the outcomes that they need.
Yeah. Because it's easy for us to presume that there's one way fits all or one method of communication that works for everyone.
Yeah.
Having seen us make increasing use of the reasonable adjustments flag in the last 6 to 12 months, say, as we've become more familiar and aware of the importance, it definitely does when it pops up, and makes you aware of what adjustment somebody needs in order to access care. That does make a big difference, and building on that's definitely a key element of the strategy to my mind.
Yeah. The 6th area that we need to remember as well is the sustainability of the whole process, because this is a 5-year strategy.
Yeah.
It's going to be a long journey for us all. It's a strategy. It's not a roadmap that gives us absolute directions as to what's going to happen, and a lot will change during that 5-year period. But certainly, if we're going to succeed, I think the priority areas of integration of our care, prevention of illness, and delivery of long-term condition management is vital if we're going to succeed.
Yeah, it'll be an exciting time over the next few years as we build upon the strategy and those 6 priority areas. We engage with our staff and make sure that they have opportunities to develop to help us meet the outcomes and aspirations that we have, and with patients to understand and make sure we're getting it right as we go along the way.
I think you're absolutely right, yeah. And there will be a lot of discussions held, I'm sure, both with our primary care and secondary colleagues, but also with our patient groups to make sure that we get this right. Thank you for listening to us having our chat here today. Just to remind you, the 6 priority areas that we are going to focus on are patient access, integration of care, long-term condition management, prevention of illness, equitable care for all our patients, and sustainability across the whole of the organisation.
And it's so important to us that this strategy is built upon and developed with our colleagues within primary care and the patients that we're providing this care to. The link's going to come up with where you can get more information on the clinical strategy, and we really look forward to your input. Thank you.
Thank you very much.